Dr. Veena Bhatt. She is Emeritus chairperson of Artemis Hospital and Daffodil by Artemis. She has earlier worked as a HOD Gynecology Department with Max Hospital. And she is a recipient of prestigious President of India Daffodil Award, Gold Medal. And of course, she has got so many other awards, and many of her papers have been published on gynecology. We wanted to know something about cervix cancer. What are the initial symptoms of cervix cancer, and is there any screening available for early detection of cervix cancer?
Thank you very much, and it's quite heartening to see you taking this cause and making the women aware about the symptoms and other aspects of cancer cervix. Cervical cancer symptoms, women usually come with normal vaginal bleeding. So there is bleeding maybe around the menopausal age, or after achieving the menopause, a woman comes with bleeding vaginal. Or sometimes post-sexual activity, after the intercourse, she has some bleeding, which should be taken seriously, it should not be taken easy. That's not a normal thing to happen. Or sometimes the periods get little heavy or prolonged. So these are various menstrual symptoms a woman can get around this age. And the second important symptom is sometimes women come with discharge of vagina. And that discharge is many a times foul smelling. That should also be taken seriously. You will just go to the doctor and have a checkup done. We will see whether there is infection or is there any precancerous condition which could be treated at an early stage.
Is there a screening test?
Oh yes, that's a very good thing about cancer cervix, that there are screening tests available and which should be availed, because to prevent cancer cervix happening in women, it's very important to screen yourself and then to prevent it. So we have both the screening thing for cancer cervix and we have the prevention also. So the screening test is, there are two tests available, and the commonest one is a pap smear test.
Okay.
So what is pap smear is that we take a little discharge from cervix, the mouth of the uterus, and send it for testing to check on any abnormal cells. So which could be precancerous or sometimes cancerous, or besides the cancerous or precancerous cell, there are sometimes infections or inflammation on the cervix, which could be treated in time and would prevent the progression of the cancer cervix. And there's another test which is called HPV, or human papilloma virus. So again, it's done the same way, the way we do a pap smear. We collect the little discharge and send it to find out if this virus is present in a woman. And you'll be surprised to know that all sexually active women have 80% chances of having the HPV virus. 80% women having this virus. But the good thing is that this virus disappears in about 90% of the cases.
Right.
And it's only 10% of the cases that this virus persists. And if this virus persists, it can lead to cancer cervix in next 5, 10, 15 years time. So that's how it's very important to check with pap smear or HPV. So when should we do this testing is, we ideally should start doing the pap smear at the age of 21, which means in young girls. Yeah. So if not 21, by the age 25, all women or the girls should go in for a pap smear test. And the periodicity is that you do it after every 3 years, which is not a bad thing. If a woman goes to a doctor once in 3 years, get a pap smear done, and if you are clear if the pap smear says it's negative, means you don't have cancer cervix or a threat in the next 3 years' time. And if you do HPV test, it is to be done after every 5 years. All the more important, you can do HPV 5 yearly, or you can do pap smear 3 yearly. Or you can combine both the tests. If you combine both of them together, then do it 5 yearly. And it is done till the age of 65. Once you attain the age of 65 and you know all your previous reports were normal, you don't need to do after that.
And I understand there is vaccination available for
Yes.
cervix cancer. How
Again-
many doses should be taken, at what age this vaccination should be taken?
Again, a good news about cancer cervix that the vaccine is available. There's
Right.
no other genital cancer which has any prevention.
Right.
So that's why it's important to make people aware that the vaccination is available and everybody should encourage their children to go in for vaccination.
What age they should take it?
The ideal age is to start early. 9 years of age is recommendation that you start giving the vaccine.
How many doses?
So this is called HPV vaccine, and in India we have two vaccines available. One is Gardasil, another is Cervix. So if you take vaccine between 9 to 14 years of age, you have to have only 2 doses. At an interval of 0 and 6 months. You take 1 dose today, the next dose will be after 6 months. Now, if you missed this time period of 9 to 14 years and you decide to take it afterwards, beyond the age of 15 years, you have to take 3 doses. So the 3 doses interval is 0, 1 to 2 months and 6 months. With one vaccine, which is Gardasil, you take 0, 2 months and 6 months. With the other vaccine, Cervix, you take 0, 1 month and 6 months. So this gives the protection to these
Rest of
girls.
the life.
Yeah.
Are there any side effects of this?
Before we move on to other things, so once you have vaccination done in girls, this is not the replacement for your screening test.
Okay.
You've had your vaccine, so don't think that I'm exempted from screens. You have to do periodically
Okay.
screening as well.
Okay.
So the pap smear and HPV stands as it is, and the prevention happens with the vaccine.
Okay. Are there any side effects of this vaccination?
Not really. The side effects are same as with any other immunization or any vaccination, which are very minor side effects. Like at the injection site, the person can have little redness, soreness, or swelling, or maybe sometimes a little headache or nausea or dizziness, which are minor side effects. Nothing literally grave side effects.
Suppose you have taken, someone has taken vaccination for cervix cancer. Does it help in reducing the chances of uterus cancer?
No. So taking the vaccination prevents you only from the cervical cancer.
Okay.
Because it gives you protection from that virus, this HPV virus, which doesn't have to do anything with the uterine cancer. Uterine cancer is a separate entity altogether.
Okay. And what about those people, those ladies who have not taken this vaccination? What precaution you should suggest they should take so as to reduce the chances of cervix cancer?
Yeah, vaccination can actually be taken till the age of 46. Now,
Okay.
yeah, till 46 you can have this
Okay.
vaccination, but it's recommended the sooner you take the vaccine, the better efficiency it gives you.
Right.
Now, the women who did not have this vaccination and what precautions, you basically have to make sure that you have to have safe sexual practices, which means that avoid multiple partners.
Right.
And the girls, young girls or young women have to have some barrier contraceptives, which means that the males should always be using the condoms because it prevents you from sexually transmitted diseases
Right.
and the transmission of this virus. Third is that whenever you have any reproductive genital infections, symptoms like you have discharge or you have bleeding after intercourse or some unusual bleeding happening, you must always go in for a doctor's advice, get a checkup done, and same the pap smears and HPV can be done, which will prevent the disease in the long run.
Coming to the next one, uterus cancer. What are the initial symptoms one notices in the case of uterus cancer?
Yeah, so uterus cancer, or it's also called the endometrial cancer, the usual symptoms are around the perimenopausal or menopausal age group. Menopause is when a woman stops her menstruation for a period of 1 year. That's when we call it menopause. Now, if a woman has stopped her menstruation and suddenly she comes up with some spotting or bleeding, we should take it seriously. We should not think that, it's normal. Stopping your periods for 1 year and starting bleeding is not normal. Or around the menopause, if a woman gets heavy bleeding and she literally passes out of clots and bleeds for too many days, that should also be taken seriously. Or sometimes they have little intermenstrual bleeding, that periods are there, but in between the periods she gets the bleeding. These are various symptoms which a woman can present with, and sometimes the vaginal discharge also, which is blood stain. Those are the things when you should go to the doctor and report it, and the doctor will check her up, and it's a simple checking. The gynecological examination will make it sure that the organs inside are fine, and if there is some abnormality, that is detected by the ultrasound. So on ultrasound we check the uterus, and it's basically the lining of the uterus which is important, which is called endometrium. Suppose the woman is menopausal since 5 years and she suddenly comes up with bleeding. We check what is the thickness of this lining. If it is within normal range, then you don't worry. If it has gone beyond the normal range, that's called endometrial hyperplasia or thick endometrium, which we need to biopsy and see that is it a benign condition, or is it a precancerous, or is it cancerous. That's how we can catch these cancers at the early stage and prevent it progression.
What normally you suggest precautions should be taken by the ladies so as to minimize the chances of having uterus cancer?
Yeah, so basically there are many predisposing factors or the risk factors with this uterine cancer also, which are like obesity. It has been seen that there's a strong relationship between the number of fat cells you have in the body. It produces a lot of estrogen. So there are two female hormones, estrogen and progesterone, which are supposed to be in balance. But at any point of time, if your estrogens are high in the body, that's not a good situation. It can lead to uterus cancer in the long run. So the number of fat cells you have in the body, the estrogen levels go up. And that is the more of estrogen in the body leading to the cancers later on. So obesity is one important factor, diabetes is second thing, hypertension is third thing, infertility is fourth thing. So these are various factors which have to be controlled at the earlier stages to be taken care of, which means that a woman should have a healthier weight. Weight control is very important. The physical activity, it has been seen that there's a strong relationship between having the incidence of cancers and the activity. The more you have a sedentary lifestyle, the chances are more. The more you are active, the incidence is less. So maintain a healthy weight, live a physically active lifestyle, and whenever any abnormal symptoms occur like bleeding, which is unusual, or after the menopause or after the intercourse, these are alarms. Have a gynecological checkup annually, get the screening done, have these vaccinations in time, which will prevent cancer, cervix, same way, maintain a healthier lifestyle to avoid this situation.
So just apart from your technicalities, just there is a myth people say that eating too much of regular onion helps in reducing the chances of cancer, or avoiding eating sugar so that multiplicity of cells does not take place. These are the myths, or
No,
is it
no, no.
actually scientific?
There is a relationship between your diet, what you eat, like when you're talking of sugars. Sugars are totally, to be reduced, to be minimized as much as possible. So diet has a very important role in these, cancerous situations, whether it is colorectal, breast, uterus, ovaries, cervix, anything. So we have to have a healthier dietary habits. Beyond the age of 40, a woman has to reduce the salt, the sugar, processed food, bottled food, red meats. All these things have to be minimized as much as possible. Same way, you don't know these days, the dairies also, they inject the testosterone in the vegetables and fruits, and the girls come up with polycystic ovarian disease, which again in the later part of the life is a predisposing factor for the cancers. So we have to keep a check on our diet, we have to keep a check on our weight, we have to keep a check on our physical activity and the regular checkups.
Any other specific tip you would like to give to the ladies so that the chances reduce?
Try to stay healthy, try to
Right.
stay active, and don't hesitate in going to a doctor. Just one annual examination is what it
Right.
costs.
Right.
That's it. The way you're checking your blood pressure, you're checking your blood sugars, you're checking your lipid profiles. Have a gynae checkup done, and it will do a lot of good to you.
Thank you very much. Thank you so much. I think this should be useful to everyone.
Thank you.
Thank you so much, and
Thanks.
thanks for sharing your